Namaste, good afternoon, and welcome to ePathshala. Again, on the subject of social medicine and community health, we have been discussing healthcare delivery systems, and today we are going to discuss the job responsibilities of the district health officer. Thanks to the development team under the guidance of Professor C.T. Mishra and his coordinators from Aligarh. So, thank you. Now, coming to the learning objectives. Learning objectives, we want to know what are the functioning and what is the job responsibility of the district health officers. Since district health officers are going to be placed at the first referral units, theirs is an important function of both acting as doctors, acting as consultants, acting as referral surgeons, participants in the national health program. So it's a big job responsibility as far as we can see, because whatever all functions are passing through these district health officers, and they are responsible for a large number of the health programs which are running in the country. So number one, jobs related to the national programs, because like I said, whatever national programs, it is being channeled through the district, so it has to go under the eye of the district health officer. Then the different acts and rules they have to know, because they are acting as mediators between the periphery and between the center. Third, most important, after the national programs have been set into motion, the disease surveillance. This is important because it's not only one disease which they have to keep a check. They have to keep a check on the many national programs which are going on. And just to count, malaria, filaria, and HIV, then mental, and apart from that, the eye national programs of trachoma, blindness, and several of the other functioning diseases. Then community participation, now on them is also dependent on the fact that they have to get community participation and carry out IEC formulation of information, education, communication activities. Then along with that, coordination and projects. Administrative functions are there, because in any case, the registers have to be completed, payments have to be made, salaries have to be given, and orders have to be given, examinations and checkups, and last of all, monitoring and accounts of the entire center has to be seen. So it is not a small and easy task. It is a big task which the district medical officers have to see to every single hour. So it is literally a 24/7 job. Now, introduction. The chief medical officer, the chief medical and the health officer, that is the CM and the HO, in his capacity as the head of the district health administration, will be responsible to achieve the health goals in the district through appropriate planning, effective implementation, and monitoring of all preventive and curative healthcare activities in the district. Now, whatever said and done, he is the basis, he is the nodal point in this entire healthcare system and field. Now, he has to receive orders from the apex bodies, and he has to translate those orders into activities which now he has to institute at the CHC and at the subsectors. And in any case, he has to be the referral and the nodal point, which is a very important activity as far as the chief medical, his position is concerned. So he's the head of the district administration, and he's responsible. Now, apart from this, he also has to see to the weather hazards or the natural disasters which keep occurring from time to time. There could be a drought, there could be a famine, people could be dying, there could be malnutrition, there could be floods, there could be earthquakes. He has to see to, or there could be too much of rain, and villages may be cut off. So he has to see that supplies of medicine, food, they're all being programmed and being sent to this. So his is a very nodal and a very important function. Now, he will also be responsible for the coordination with all the government departments, the NGOs, the social and the community. Like I said, he is the central point, he is the pivot, he is the head of all these activities, and round him goes all the activities in which he has to lead. Now, what are the jobs now? Under, like I said, if through this first referral unit, everything flows either from the top to the bottom or data flows from the bottom to the apex. Now, there are the national programs. Let us start with one example. He has to actually ensure effective implementation and achievement of the targets under the following national programs through the supportive supervision. And he has to have his team whom he has to continuously train and put into the field and support their supervision so that correct data, there is inflow of correct data. Now, reproductive child health. He has to actually see what the gynecologists, what the doctors are doing at the CHC, which is either at his level or at a slightly distant place. Integrated disease surveillance project and programs definitely has to see. He has to collect the data, and especially for malaria, tuberculosis, he has to know that a door-to-door survey has been done. All those cases which have been found are noted down, and supply of the regular medicines, whether it is an HIV, whether it is filaria, whether it is malaria, all their supply medicines have to reach them in time. Revise, so that means he has to see to the fact that medicines are there at the center in proper quantities before their requirement. So, revise under the revised National Tuberculosis Program, everything, the dots, the supply of medicines, the examination of the sputum or the examination of the sputum of the AFB positive cases, and then the attachment to the DOTS program, and thereby the treatment to be continued. Most important, keep a tag on for the monthly treatments and the monthly distribution of the drugs. Similarly, the National Leprosy Eradication Program and the National Control of Blindness, in both these programs, it is the medicine, whether it is the dapsone or whether it is the last stages. If a person is handicapped, then this man has to remember, in order to refer him to the higher authorities for helping giving proper surgeries. So that is rehabilitative surgery. And in the national program for the control of blindness, he has to see that he enters their houses at the right time to give the vitamin A drops which are being given at the periphery to the children in the proper times. And then besides that, of course, other adult cases who might come with for blindness, so they have to be treated and they have to be attached to these programs. Then most important, the National AIDS Control Program, in which he has to keep out a lookout for the history taking and for the cases who are recorded, the ELISA test positive cases, and finally their attachment with the antiretroviral drugs. Then comes the National Iodine Deficiency Disorder. So it's not only one program, it is a several series of programs in which he has to be attached and he has to see. In iodine deficiency, he has to visit the schools, he has to visit the homes, he has to check on the presence of goiters, and then finally advocate the use of iodized salt in the proper apart from that, it's not only the presence of iodized salt in their food, it is the supply chain right from the center to the periphery, so that the villagers are able to get the iodized salt at their doorsteps. Then in the National Cancer Control Program, very important, because he has to, actually this is instituted through the IEC activities. He has to give education as regards all the cancers which can be easily detected from the surface. For example, oral cancers, nasal cancers, breast cancers, or even uterine cancers which may present through bleeding, and similarly the other disabilities which may present. So therefore, he has to be actually careful to see that in under the National Cancer Control Program, the people are educated, people are told to come at the proper times, and along with this, the National Mental Health Program, slightly difficult program because, like I have mentioned in the earlier chapters, mental health program to institute such a program in the village area slightly difficult because people will tend to take it and understand it in a wrong fashion. Like I said, they will only say, if you register a patient, the first question which will come from his family is, क्या ये पागल है? इसको पागल बांधना पड़ेगा, because their idea of a mental health deficiency or a mental health addition to this particular patient means, because they have visions of people being tied up in ropes and chains and put in the corner of the house. Today, that is not mental health. Mental health is approaching the patient, guiding the patient, even if he is mentally disturbed, because this could have adverse effects on his health program. Now the National Vectorborne Disease Controls. So under that you will have the malaria, the filaria, the kala azar, the dengue. We have to keep a checkout for that. He has to keep a checkout for all these, because once this starts, an epidemic will start in no time. Most important, the school health program, very important to catch the children at the right age for disability in hearing, visual defects, help the growth programs, blindness, and similarly others, and also for those people who are hyperactive. You have hyperactive children, and it is important to control these, because they must be controlled. As we must know as to why they are so hyperactive, because some of them, because of certain conditions in the somatotropic hormones or whatever it is, they need to be caught at the right time, and they need to be treated properly. So you have to facilitate, coordinate, supervise, monitor, and implement the provisions of all the health sector acts and rules therein, including Mental Health Act, Persons with Disabilities, Prenatal Diagnostic Tests Act. This is a very important act. The MTP Act, Prevention of Food Adulteration, Drugs and Cosmetics, Human Organ Transplant, Biomedical Waste Handling and Management Rules, because all these actually come under the district head. And since he is the district medical, even throwing of syringes or using of cotton or of needles used on HIV patients, so all this has to be taken care of. Or a person getting radiotherapy, all the biomedical waste coming as a result from those OPDs and from the OTs, he has to see that they have been treated and they have to be ultimately got rid of very comfortably. Now, in disease surveillance, he has to also prepare an annual database for emerging pattern of diseases through collection of data, and plan appropriate interventions for effective prevention and control of diseases. Then he has to actually introduce and implement systems to identify early warning symptoms of seasonal diseases, and he has to take effective steps for prevention and control of the same. Then he has to, under the communicable diseases, in certain areas where these are prone for those diseases, so he has to set up the Kala Azar prevention related insecticidal spraying activities for malaria and the filaria areas, then ensure surveillance and effective measures for prevention and control of vaccine preventable disease, which means he has to see that as per the number of children or the under 5s found in the peripheral areas, there is sufficient amount of vaccines which are available at his center, so that he may send the vaccine to further on to the CHC and to the sub centers for vaccine distribution at time to control the preventable diseases of childhood. Then identify the causes of maternal and child health morbidity and mortality and take measures for their reduction. Now, community participation is absolutely important because it's not the fact that he just orders and things will be done. 100% community participation is important to make any program in the community successful. So he has to take necessary steps to involve community, and in the community he has to involve the NGOs and the PRIs, the social and the religious leaders, the other government departments and public representatives in planning and implementation of health and family welfare programs. Then he has to also ensure effective coordination with the Panchayati Raj institutions, because he must coordinate all these activities with the agreed permission of the Gram Sabha or the Gram Panchayat. It's very important because this is an important body, a legal body, and he must work hand in hand with them so that whatever programs are instituted will have a smooth sailing and right down to the village level. And as laid down in the government instructions from time to time, and also ensure effective implementation of the government orders, then he must take steps to involve the private sector in health and family programs. That means not only the community participation, he must also invite the medical and the other organized sectors in order to help him to carry out his job as part of a whole sector. Most important, without IEC, without information, education, and communication activities, no program can be successful. Now, information, a word about IEC activities. Information, education, and communication material has to be so planned that it is effectively given, it is effectively absorbed by the people for whom it is meant. So, the people who are going to give the communication, the people who are going to absorb the ideas, so it must be so clear that these ISC activities must lead to the acceptance of the program and the further input so that the program runs very safely. So, we effectively assess and organize the IEC activities relating to health and family welfare in the district through the district IEC Bureau, PRIs, ICDS and the other government departments, and of course the NGOs. Now, coordination of activities must be there, because whoever works in the peripheral area right from the district to the level, they must act in coordination in hand to hand. Any person working in singly cannot act, because this doctor has to work with the superiors, he has to work with the juniors, he has to work with the village panchayat, he has to work with the other doctors or the medical facilities available in and around, and he has to work with the panchayats, with the mahila mandals, whoever are available, these bodies are available, he must work along with them. So the district health society, he becomes a part and parcel. As a district advisor, the ICDS, he has to implement the health components of ICDS program. Then he must also convene regularly the meetings of the district health society and other committees at district level and ensure implementation and follow-up of the decisions of these committees. Because whatever said and done, all the matters should be put on the table, and the ultimate decision should be that it should incorporate and include all the good suggestions and thereby make a good and an active plan. He must also maintain a close coordination for active cooperation in healthcare programs with the district collector, the Panchayati Raj institutions, education, welfare and public relation and information departments, and most important, the other activity agents which are in that area. Now, what are the projects? If any projects are running, then he must ensure effective and timely implementation of the ongoing projects and achievements of physical and financial targets through his respective officers. This sentence merely means that whatever projects are going on in terms of the national programs or in terms of the district programs, either by the center, by the medical world, or by the collectorate, he has to have a hand to foresee how it should be done in the best interests of the people concerned, and that both the physical and the financial targets through the respective officers are met. That monitoring should be done of all the financial as well as the activities which are going on. So therefore he must learn to supervise through quarterly monitoring of the sub-district hospitals, the CHCs and the FRUs, and ensure submission of quarterly reports to the regional and state level officers. And he must maintain the management information system, and he must have the data validating this particular data. Now, what are the administrative functions of this district health officer? See, all the postings, the transfers, including redistribution of medical, nursing, paramedical personnel. See, basically, he has to keep an eye open for all the functional activities of the people posted under him, whether at the center or in the other centers. So, therefore, he has to see wherein the best person can give his best in the best situation and in the best post. So, therefore, the postings and the transfers are important. We have to ensure availability of all the health workers. We have to furnish the monthly reports to the regional and state level authorities. They have to carry out the routine and surprise inspections of all the subordinate officers and take up follow-up actions, ensure that the problems and grievances of the staff are promptly resolved, and take out timely reactions for the RTIs, the court cases, and a quick implementation of the orders of the courts. Identify, because he's working hand in hand with police, he's working hand in hand with law, so he will need the help and the coordination of all these people. Then he has to also identify the low performing institutions, not only the effective, but those institutions which are not performing well. He has to take remedial actions for optimum performance and bring them up to date, as well as take actions against the non-performers. Then he has to also ensure timely and adequate supply of drugs, including equipments to the health institutions, as well as the adequate buffers in the district stores for all the emergencies, particularly during epidemics, floods. So he has to be, in fact, what is known as literally a weatherman. He has to foresee what the weather has to offer him and his community and be prepared to fight that particular battle. He has to issue requisite NOCs, no objection certificates, to industries. Most important, because industries will come up, small scale industries, large industries. So he has to have a hand that they would not be producing any such substances which could harm the health standards under the various acts of his community. So they have to be in confirmation with what is required. So then he has to facilitate the strengthening of the PRI in contact with the health and the family welfare programs. Then he has to conduct and in case of deaths, especially of maternal deaths or infant deaths, he has to have a maternal death review, so that these reports can go and in future work out actions to prevent any more maternal mortality. And timely completion of the civil work. If there is any digging has to be done, canals have to be made, water supply has to be made, then it is perfect, because he has to complete it. Most important, the district health action plan preparation has to be done by him, and it has to be carried out very comfortably. Now, he has to obviously maintain contingency plan for disasters. So he has to have money, he has to plan for vehicles, he has to plan for insecticides, medicines, and be personnel to take them on a fast route track to the peripheral areas. Updating the service entries in the service book. Now, these are all mundane office matters, but he has to do it. Ensuring the functioning of the Quality Assurance Committee, operationalization of the sub-centers and the primary health centers, and most important, land identification for sub-centers and opening any new sub-centers if it is needed. He will also be responsible for verification of the daily diaries of the district officer. When he will visit, he has to check and sign the diary. He has to take, in other words, he is actually a police commando who has to take action whenever the situation demands. Handling the individual grievances of the staff is also on his register, and which is very important. Most of all, let us not forget the financial matters. He has to ensure appropriate utilization of funds as per the guidelines and the GFR provisions. He has to furnish accounts of all the funds received in the district, including district health society and committees for the health facilities, as well as village health sanitation committees, and ensure that auditing procedures are completed well in advance and audit reports are furnished to all the concerned authorities. Then, most important, he has to dispose of all the obsolete condemned items and vehicles as per the government orders in Turkey, because and this is a very important, because collection of rubbish merely takes up space, and in most of the primary health centers, if you visit, you will at least see all these condemned items lying out in the open, and people are not bothered. For years, you will see them lying, getting junk, trees are growing into it. So, and actually, they become vehicles for collecting water, and thus, in fact, making a nice, preparing a ground for mosquito breeding. So, all these must be cleaned up. Monitor, guide the activities of the sub health centers, the primary health center, the CHC committees, patient welfare societies of hospitals, village health and sanitation committees. Most important, maintain coordination of primary and secondary level healthcare facilities. And the other fund utilization on time should be done, and timely disbursement of the salary on the due dates is essential. And most important, to summarize, his functioning is very important. And the role of the district health officer is basically to ensure effective implementation and achievement of the various national program targets, along with carrying out and monitoring disease surveillance activities, ensuring and encouraging community participation, IC activities, coordination at various levels, administrative and accounts management. In fact, he plays such a key role that he is just like Sri Krishna working in the center, and all the activities have to be at his fingertips. So that is all for today. Thank you for visiting ePathshala.